Everybody. Thanks for joining us today. Really appreciate it. I'm David Forges, Vice President for Human Resources, Diversity, and Inclusion. For those that don't know me, thanks for joining us. The purpose of our forum today is just to provide updates on COVID and OC, to update you on the reentry activities across campus, talk a little bit about testing and vaccines, and how we aim to navigate our ongoing pandemic experience. Yesterday, Academic Affairs hosted a forum for faculty, and our plan is to do these forums monthly, one for faculty and then one for staff and management, mostly because we know that some of the questions are different. We want to be able to have time to answer those questions. We know the different constituencies have different things that they want to ask about. Please look out for the communication about those. I think that April 1 is actually the second week of April. May, we go back to the first week of May, and then that's as far as we've set dates out, but we will continue to hold them thereafter. In addition, you saw, I think yesterday came out, Stratcom sent and will continue to send a weekly communication regarding COVID-19 and campus reentry. The subject might change a little bit weekly. Our goal with those is to send you the most recent information and updates, so please continue to look out for those as well. This presentation will be recorded and will be available on our HRDI website, so please feel free to share it with friends or take another look at it at some point if there's something that we move too quickly on that you want to refer back to. And with that, I'll just say thanks for coming, and I'm going to turn it over to Mary Becerra, who's the Director of the Student Health Wellness Center, and she's going to give us some of those updates. We are extremely fortunate to have Mary as part of our reentry team. Mary has kind of the direct line to the county, so she always gets the straight info, and we're really grateful for it. She's been a terrific partner in this work. So thanks, Mary, and go for it.
Thank you very much, Dr. Forges, and thank you for inviting me to be here today. Welcome to everybody. I can't always bring the best news, but today I can bring very hopeful news. We have definitely been in a downward trajectory for trends and for incidence rates, and so we expect Orange County to be moving down a tier. So for those of you that have been following the tiered system for the state that generally provides us with reopening guidance, there are 4 or 5 tiers in the system, and we're currently in the purple tier, which is the most restrictive tier, which is why we can't have face-to-face instruction on campus right now. But as these rates have progressed significantly downward over the last couple of weeks, we expect to be in the red or even orange tier within the next 2 weeks. So we're looking at changing tiers the week of March 22nd. And so hopefully we can be able to start looking at people coming to campus in a different way in the next couple of weeks. With new tiers, we expect new guidance from the state of California. So those of you that have been watching the news know that every day it feels like something new is being added to either guidance or opening up. We were just talking a minute ago, some of our panelists, about how excited we are that youth sports is now opening. That is new this week. So things are progressing rapidly in the community. But please know that our approach on campus has been slow and steady, and it has served us very well. We have been able to avoid very difficult outbreaks and things on campus here because we've taken a very cautious approach that has been based on health and safety. So as we learn new information, I advise our reentry leadership team, who then makes decisions for the out to the campus. And so I will continue to do that so that our campus has the most up-to-date information. But some very good news that I also have to share with you today is about employee testing. We have been able to successfully pilot test our new employee testing program here on campus today with some select staff, and that testing will go live starting next week. So our employee testing dates will be Tuesday, Wednesday, Thursdays. Employees who are currently working on campus 1 or more days a week will be eligible for on-campus employee testing, and it will be scheduled through an online portal. Instructions from that are going to come out from Human Resources next week, so please be looking for that. For employees who are working remotely, you are welcome to engage in testing through your primary care provider or through the many different county resources that are available. And I want to reiterate again that all COVID testing should be free. So if you are asked to pay for any COVID testing or a copay related to COVID testing, you want to follow up with that and ask some additional questions. The only type of testing that is not necessarily free is rapid testing, rapid PCR testing. That is a different type of test that does not have to be offered for free right now, but we are happy to announce that on campus, our employee testing will be rapid antigen-based testing. Employees will get their test results within a matter of hours. So again, be looking on Monday or Tuesday for an email from Human Resources on instructions for being able to get access to that testing, but we're really excited to be able to bring that to you. The next slide is going to talk about some vaccines. We know that this has been the hottest topic right now for all of our staff. So just within the last 2 weeks, the state of California released Phase 1B Tier 1, which had educators, childcare workers, emergency responders, food and agricultural workers in that tier. And so with that tier release, anybody who works in an educational institution, including higher ed, is considered an educator under that definition. So you began receiving notices from Human Resources to log in to a variety of platforms to be able to register and get access to vaccine. And so some things we've learned since that email from our HR went out to today is that, number one, vaccine is becoming more and more available, especially after the emergency use authorization was granted for Johnson & Johnson. But allocations are still not meeting demand. So there are millions of people that fall under that Phase 1B Tier 1 category in California. It's going to take vaccine distribution sites a little bit of time to get access to plenty of vaccine for our population. And so what we are recommending to people is try any and all platforms and avenues to get access to this vaccine. We've had a lot of staff report back that they've had a lot of success with local clinics and retail pharmacies. Walgreens, Rite Aid, Altamed has been one that people have been able to access. Make sure that you search far and wide. So if you're willing to travel about 20 or 30 minutes from your home, try those zip codes, because Riverside and San Bernardino counties and LA County have had a bit more supply than the retail pharmacies here in Orange County. Also, you can try, if you live in another county, try that county's resources as well. Some counties have been given more allocation than here in Orange County. Right now and statewide, we are prioritizing K-12 educators. That is a big push that's coming from the federal government through the state down to the county. So again, K-12 is being prioritized, but those clinics and retail pharmacies have been much more successful for some of our team. You can contact your primary care provider. However, primary care providers right now are still prioritizing those that are in the highest risk categories, 75 to 65 and plus, healthcare workers, those living in skilled nursing facilities, and now those with certain underlying health conditions. So again, try any and all avenue, keep checking back, connect with each other about what's working. I know that some people are finding, little things here and there that have been helpful. So keep checking with each other about what's been helpful. The last platform to try is our Othena platform here in Orange County. Again, registering through that platform, we've just heard today that some of our folks on campus are getting invitations for vaccine there. So that does appear to be another avenue that is opening up. But again, any and all options, we would expect you to try. And so we are looking right now at the possibility of hosting a vaccine clinic here on campus. We are months away from that if it will happen. So again, we are encouraging folks to try the off-campus resources wherever they can. And on to our next slide. I want to show you a little bit about our tracking and tracing efforts. So just so folks understand, anyone reporting to campus who all of a sudden is symptomatic or has told that they've been exposed, we have a team called the Cal State Fullerton COVID-19 response team that will notify members, employees that they need to remain off campus, and it will follow up with a written notice from Human Resources. That will come to them through email. Currently at Cal State Fullerton, we are still implementing a full 14-day self-quarantine. The reason for that, even though CDC, California Department of Public Health, and our Orange County Healthcare Agency all allow for a 10-day quarantine timeframe, our Orange County Healthcare Agency has put some stipulations on that Cal State Fullerton at this time cannot guarantee. So we are moving forward with a full 14-day self-quarantine if someone has been exposed, and that would require them to stay off campus for that period of time, remain in a residence, and monitor for symptoms. And again, if we are notified of that, we will provide appropriate instructions to those employees and make the appropriate notifications about exposures on campus. We are so lucky on our campus that we have an amazing group of employees who have really worked hard to follow our mitigation measures, wearing the face coverings, keeping social and physical distances, making sure that they're on campus only for those critical needs, and again, making sure that we are following all of the appropriate safety protocols. It has really served us well. And as we repopulate, we will continue to work on the messaging to our community that we can keep those expectations very much alive here on campus. On our last slide that I have, there are some additional resources for you. So there's all kinds of ways to get information. As I said, this information changes daily. Sometimes hourly, we get updates. Here are some websites that I have found very helpful, that this is where we go for information, where we go to get information out to our campus community. Our first is our Titans Return, our COVID-19 recovery website. This website is going to list all of the most up-to-date information about re-entry, instructions for re-entry, and important safety information that you will need. Some of my colleagues later on this call will talk a little bit more about information that is up on that website. Human Resources also has their coronavirus website and additional resources for specifically employees on the campus. The Orange County Healthcare Agency is where we are watching our county trends, which is very much going to help inform what we can do on our campus. And then last but not least, our environmental health and safety website has our very comprehensive safety plan, including how to report a hazard for COVID. So again, you'll want to check these websites out as they can provide a lot of very important information. So with that, I'm going to turn it over to my colleague, John Beisner, who's going to give you some additional information about health and safety.
Thanks, Mary, and welcome to everyone. Good afternoon. I have some health and safety updates related to facilities, which may not be as exciting as vaccines, but they're equally as important. And as Mary said, I do want to encourage folks to share their experiences as far as how they were able to get vaccine appointments, because that's how I was able to get my appointment. And I know that that builds a sense of community. And if we all work together, I know that we'll be able to ensure that those that want to get vaccinated will be able to get vaccinated. So in the area of facilities, last year, the university developed many different work programs and safety practices for every classification of employee, for almost all of the position responsibilities. And in the year that we've just experienced, we've learned a lot about COVID. We learned a lot about how it's transmitted. So the university is in the process of working with a consultant to update all of those practices, because we want to ensure with our reentry in fall 2021 and in summer of 2021 that we're following the latest best practices, that we're doing those things that put us in the best position to continue education and keep our community safe. I know that there's some things that were really last year that we're going to learn may not be quite as important, and I know things that we didn't necessarily focus on last year that we'll need to focus on this year. So just know that we're really taking a step back to apply all that we've learned as we move forward. We've learned a lot that building management is important, and some of our buildings haven't been used as much as they are pre-COVID. So we're taking steps now to prepare for return in the fall. We're flushing water systems. We've upgraded all of the HVAC air filters. We're adjusting air exchanges to increase the number of fresh air intake throughout our buildings. And those last two practices are really important that we learned that moving forward, that's one way to and prevent transmission of the disease while people are in person in buildings. And I'd like to introduce Leo Lopez, who's the university's interim director of environmental health and safety. And he's going to give you an update regarding our cleaning and space reentry procedures. Leo?
Great, thank you, John, and good afternoon, everyone. So when it comes to cleaning, the restrooms are cleaned and sanitized several times per day. And to help with that, the assigned custodians, leads, and custodial managers, they ensure this process continues. And they even go to the extent of documenting the events with regular inspections and routine inspections of restrooms, common use areas, meaning like hallways, handrails, things like that, the high touch surfaces. And so they log all that information just to ensure that, that the proper cleaning is taking place. For space reentry, there's environmental health and safety works very closely with multiple areas, and that includes academic affairs, planning and design, our carpenter shop, and finally EH&S, we're responsible for doing the final reentry assessments, and that's to determine the COVID capacities of classrooms, just to make sure and ensure that there's appropriate spacing, physical distancing between amongst the people that are going to be occupying these spaces. And so there's a lot that goes into it with putting signage, decals, ensuring personal protective and hand sanitizer, disinfecting wipes, that it's always available in these spaces. And when it comes to personal protective equipment, the university has given that that responsibility to environmental health and safety, where we actually have been able to procure lots of personal protective equipment, including other disinfecting wipes and cleaning supplies that are available to all campus employees at no cost. And to ensure availability, we've actually made several central distribution sites in different parts of campus and different for the colleges. So it's just that they have the central distribution site where they can go and get supplies there, but knowing that environmental health and safety is always here to provide this equipment, to provide these supplies. Anytime our website has that information, we actually have a link that John's going to talk about in a minute. It has a link where you can actually put in your request, and the environmental health and safety will receive your request, have those supplies available for you, and you can pick up here. But again, you have the convenience of having these supplies available to you near your department and within your department of your college. And with that, I'm going to hand it off to John.
Thank you, Leo. There was a question in this chat about increasing custodial staff to ensure cleanliness. And I think that we've been able to do that. We've ensured that we've had appropriate resources to clean the spaces that we know that are in use. That's why it's really important to follow your division or your college's reentry plans. That's really important to use the single day access pass, so we have a sense of who's on campus, where they are on campus, so that we can make sure that those spaces are adequately and appropriately clean. And as Mary mentioned, we've been very fortunate because everyone has bought into the mitigation measures that we've implemented, that we've had very low rates of on-campus positive reports, and those that have been on campus, we've been able to address very quickly. So we watch those numbers a lot to make sure that we address and appropriately account for the folks that we have on campus. Signage is something else that we're focused on. We anticipate that there will be more students and more employees on campus in the fall. So just as we're reviewing our protocols, we're reviewing our signage to make sure that we can accommodate the number of folks that we provide information, and it's effective. And so know that we're implementing that now, we're redesigning that, and we're working with that to make sure that that's one more tool that we have in our kit to help mitigate any transmission of the disease. And finally, we work with our outside vendors so that those vendors that are on our campus to make sure that they've implemented COVID-19 protocols and they're following the protocols that we have in place. Mary mentioned this website. It's worth mentioning it again. If you have questions about our approach to coronavirus, I encourage you to go to the coronavirus website. One of the tiles speaks of a reentry dashboard. You can access that tile using your portal login, and once you're in, there's a plethora of information about how to request PPE. the safety practices and the work programs that I mentioned earlier, division reentry plans, the number of folks that are on campus. So please take advantage of those resources to educate yourself. And then if you still have questions, please ask those questions because we learn a lot. Leo, do you want to talk about the resources on the EHS website?
Yes, thank you, John. So the Environmental Health and Safety website has developed a tab it's called COVID-19 Safety. And just like John mentioned, this also has a plethora of information related to COVID-19. And one of the main things that you'll see on the very top is one of the tiles that says CSUF COVID-19 Safety Program. It also has a tile for the Building Reoccupancy Safety Plan. There's several other resources. You'll see a tile for training. There's specialized training for custodial, research, trades. There's many different types of training. It also has the direct link to request personal protective equipment and other cleaning supplies. And other just resources that we have there are, there's a direct link that goes straight to the Orange County COVID-19 testing locations. So you know where different locations are across the county. And there's also supplies distribution. I was mentioning earlier about the supply distribution centers that we have across campus. There's an actual map that lists all the different locations, including the room numbers, where you can actually find these center distribution sites. And so I definitely recommend going to that site, finding information. You can always check with your chair, your department chair, your dean. They probably most likely they already know about this, but regardless, the information is there, the map is there. And you can always reach out to Environmental Health and Safety. You can always send us an email at safety@fullerton.edu. You can call us at extension 7233, and we're more than happy to guide you through our page and point out some different things just to make things easier and convenient for you. Thank you, John.
John, I think there is a question that came in about students that may be planning to live on campus. I know that the reentry leadership team is looking closely at that, working with the folks in housing. So there will be additional updates about that. Please know that that is certainly part of, this is one of the populations we're concentrating on pretty intently in our reentry leadership team conversations too. And a couple of people reported that they've had success getting vaccination appointments. So somebody through Kaiser and somebody through My Turn. So excellent, kind of echoing what Barry had said, that there are those many options out there, including some of the local, what do you call them here? Retail pharmacies. We've heard about a bunch of those and that kind of stuff too. So, yep. Okay, John, are you good? Should we move on?
I think we're ready to move on, David.
Okay. Let's see, folks, I continue to be amazed by all of your resilience during this pandemic, and we ask for your continued resilience and patience throughout our upcoming reentry process. This is new for all of us. There's no rule book, there's no playbook, we are learning and adjusting to the changing circumstances all along. So, and we will continue to do so. As President Virgie stated in his message on fall return, we are committed to preparing for a fall return using the same twin touchstones that we have used throughout, and that's ensuring the health and safety of our Titans and upholding the academic excellence and unimpeded progress to degree completion for our students. We have and will continue to operate with the health and safety of our employees at the forefront. The reentry leadership team is working carefully to provide a safe experience for the Titan community. They work closely with other campus-wide groups, Division COOs, EHS, UPD, to assess the health and safety amongst all aspects of campus life. You've heard about many of those things today. It's why you see Leo and John and all of us here working together to be able to provide that for both of those twin touchstones. We are planning for staff to be working on campus to support students and faculty who are on campus this fall semester. We are. We don't know exactly now what this will look like or how many of us will return and on what, in what ways. If the county stays in the lower tiers, more classes can return to campus and more staff will return. As you know, you saw President Biden say by May that most folks will be able to get vaccines that want them. That's going to be a huge turning point for us, and we're hopeful that that continues. But we are beginning to plan and prepare now. Your division COO will be working with your division leadership on a plan for return. Those plans continue to be submitted and reviewed and coordinated. Each plan does vary by division, and that's important. We need, the nature that each of the work that each of us does in our divisions is different, and so that dictates for us what will need to happen and how we'll need to support the increasing on-campus operations. Those plans also need to be synced with each other so that we are careful about who's where and how many folks and all that kind of thing. So the best place for information for you to go to is to your supervisor, please. Your supervisor has, we have management calls every other week where we're giving additional information. Your supervisor has been giving marching orders in terms of talking with you about reentry and about what that means in each of your different divisions, departments, colleges. Please, early, often continuing conversation with your supervisor is the best thing that can happen. Your supervisor will be the one that will tell you when it'll be time to come back to campus. Your supervisor will continue to provide information on safety protocols and training. And all of our reentry processes will follow the state and county guidelines based on the tier that the county's in. You see things continue to change. There was a big change last week. Last week, the CDC said, if you've received your second vaccine and you're 2 weeks post your second vaccine, if you come into contact with someone who has active COVID, you no longer need to quarantine. That's big. And those big changes are going to continue to happen. So definitely please pay attention to those. And those are the things that will continue to guide our actions. As Leo mentioned, cleaning protocols are in place. There is a process once an area is approved to return to campus that EHS completes safety walks and cleaning protocols. When you return to campus, likely we'll continue to social distance. We'll probably be wearing masks. And more than anything, we will continue to wash our hands all the time. Lots and lots of hand washing. Number one thing for sure. Many of the divisions will be holding open forums coming up, so keep an eye on those. That's another good place for information to get. And what we do know is that conditions will change many times, and we will continue to need to be flexible. Just like we've learned to be so flexible over this last year, we'll need to continue to be flexible. We are planning for the fall to be as prepared as possible for a successful reentry. Since we don't know exactly what the future holds, including risk levels and safety protocols, we will start making assumptions so that we're prepared for whatever that eventuality may be. We will continue to adjust as conditions dictate, and we will keep communicating as we learn more. Our plans are changing all the time because the realities on the ground are changing all the time. But we are planning for return. We're planning for return for classes in the fall. We're planning for many of us to come back to campus. Some of that will continue to look differently for sure. We're looking at, permanent telecommuting arrangements that may work for some positions, not on a full-time basis, but, some limited part-time basis. Again, please talk with your manager about those things. More than anything though, we want to approach fall with optimism. We want to think of the best vaccine rollout scenarios, not the worst. We want to encourage all of our community members that are able and willing to and want to get the vaccine to do so, because those are the things that are going to help us turn the corner on this. Let's see, next. So just as a reminder, our reentry leadership team includes campus leadership. The reentry leadership team and the infectious disease working group follow and monitor daily guidance from the CDC, the state, local officials, chancellor's office, all those things. We're getting all that input from lots of different places. We're anticipating additional guidance from the state and the chancellor's office soon that will also inform our actions. The reentry leadership team will continue to work with each work group outlined here throughout the reentry process. Our goal is to be as inclusive as possible in navigating that. Let's see, a couple questions in the questions. The division COO is your chief of operations. If you're unsure who that person is, check with your supervisor. They should be able to tell you who that person is. Those are the folks that are mostly coordinating in each of the divisions. What's the reentry plans in each of the divisions. Staff will be notified as soon as we possibly can. We understand that folks will need time to make arrangements, but folks will be notified as soon as we possibly can. And we know that lots of those other things that are influencing all of us will change also in terms of where our kids are at school and all those kind of things too. But you will be notified, but we want folks to start getting in that mindset that we are on a path to coming back to campus, to being back in our offices, to kind of getting back to normal. So we want you to start thinking in that way and thinking about what that might mean for you, so that when we're ready to actually provide specific dates and move in that direction, that we'll be ready to do so. Let's see. And then finally, just the last slide, Tara, I think. We do appreciate your feedback. We need it. We want it. It does inform our planning. You saw the staff and management survey that we just completed. That was great. We really appreciate it. There was a lot of good feedback in there. One that folks mostly are feeling like they're getting the information they need, which is we're glad about that. But also lots of other good feedback across the divisions that we are sharing with VPs. We're sharing with Chief Operations. We're sharing with the reentry leadership team so that we can continue to take your feedback into account. You're welcome to contact us directly if you have individual concerns. We are here to support you. In most cases, again, your best point of contact is going to be your supervisor because they know what that means for you in your particular position, in your particular place in this big complex organization that we call our professional home. But we're happy to help with individual needs at any time. Throughout the reentry process, we will continue our focus on you, our Titan family. We will continue our information pipeline efforts. We will continue to ask for your feedback. In fact, there's actually a new feedback form also. I think it's on the next slide. We will continue to look out for your health, wellness, and safety. And there are some great resources there, including the Employee Assistance Program, Total Wellness, lots of good things out there still to build community, but also to address the wellness needs of our campus community. And finally, just a note that, you know, when this pandemic is over, and it will be over, we know that our work will look differently. We know that our campus will look differently. And what we want to do is we want to build from and expand from what we had before. We want to look at how we can leverage and benefit from some of the changes that COVID brought. I don't know about you, but I'm thrilled that we will never go back to some of those paper processes that we had. I'm thrilled that this has pushed us to show all the many things that we can do to leverage technology in our work. And continue to change and evolve. This is what we do. This is what higher education does. We're about producing new knowledge, and we're going to take that knowledge that we've learned in this very challenging time, and we're going to leverage it to make this an even better, more productive, excellent place for all of us to work. And we look forward to partnering with you on doing that. We are happy to have some more questions come in. We're happy to stick around and take some of those. So please feel free to pop them in the Q&A. But that is the bulk of the formal program that we have today. It looks like we're caught up on the questions at this moment, but we'd be happy to have any of those others popped into the Q&A, and we'll stick around for a few minutes to see if there's anything else. Otherwise, we really appreciate you joining us, and we'll see you next week for another one.